Hello students, welcome to readmedprep Academy channel. Today in Human Health and Diseases Part 1, we are going to talk about the maintenance of personal and public hygiene and introduction to the common diseases in the human beings. Now let us move on to the maintenance of personal and public hygiene. What is hygiene? Hygiene is a set of practices performed to conserve good health. According to the World Health Organization, WHO, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. What is personal hygiene? Personal hygiene refers to maintaining one's body clean by bathing, washing hands, trimming fingernails, and wearing clean clothes, and also includes attention to keeping surfaces in the home and workplace, including toilets, bathroom facilities, clean and pathogen free. Here we can see the 7 steps of how to wash your hands with soap and water. Number 1, rub the hands with palm to palm. Then rub the palm and the back of the hands. Then palm to palm and the fingers interlaced. Number 4, fingers are interlocked and washed. Then thumbs should be clasped in the palm. Fingers into the palms have to be clean. Then rub the wrist. These are the 7 steps of washing your hands with soap and water. Personal hygiene methods, you can see bathing. Number 2, you can see that the space between the skin and the nails will be filled up with dust or unwanted materials or pathogenic bacteria. So it is always better to trim and keep your nails cut. On the last, you can see we have to wear clean and pressed clothes. Below images, you can see that the surfaces of the office or the workplace or at home should be kept clean and free with pathogens. In the middle image, you can see the toilet should be clean and dry. The public toilets and urinals should be kept clean and pathogen free. What is public hygiene? Our public places teem with infection, contamination and germs. It seems that every surface we touch and the air we breathe are with pollutants and microbes. It's not just the public places that are unclean, but we might be amazed at the number of people who do not wash their hands before taking food, after visiting the restroom, or who sneeze without covering their faces. In the left side image, you can see a man coughing and releasing lot of aerosols and droplets into the atmosphere. This may contain lot of pathogenic bacteria and viruses. In the right side, you can see the correct method of sneezing or coughing by keeping a cloth in front of before performing the act of sneezing or coughing. Advancement in science and technology provide effective controlling measures for many infectious and non-infectious diseases. Many infectious diseases such as typhoid, amoebiasis and ascariasis are transmitted through contaminated food and water. So consumption of pure and clean drinking water, uncontaminated food can prevent many infectious diseases. It is always better to boil water before consumption. Prevention of risk factors can protect us from many non-infectious diseases. The many non-communicable diseases like cardiovascular diseases, diabetes mellitus, chronic obstructive pulmonary disease or cancer have many risk factors like high blood pressure, physical inactivity, obesity, raised cholesterol levels in the body, decreased vegetable and fruit intake, raised blood glucose levels in the body, consumption of alcohol, tobacco usage. All these are risk factors for the non-communicable diseases. It is always better to prevent and change our lifestyle to prevent the non-communicable diseases. The use of vaccines and adopted immunization programs have helped to eradicate smallpox in India in April 1977. In the image below on the left side, you can see a child suffering from smallpox. On the right side, you can see in the image the children being vaccinated for smallpox in the earlier days. Moreover, a large number of infectious diseases like polio, diphtheria, pertussis, pneumonia and tetanus have been controlled by the use of vaccines and by creating awareness among the people. In the image, you can see the multi-dose vaccine. The National Immunization Schedule of India is given here. where the beneficiary is the infants, and the vaccination given at the birth is BCG and OPV. In 6 weeks, it is DPT and OPV. In 10 weeks, it is DPT and OPV. In 14 weeks, it is DPT and OPV. In 9 months, it is measles vaccination. And in 18 months, it is DPT and OPV booster dose. In children at the age of 5 years, DT vaccine is given. At 10 years, tetanus toxoid, and 16 years is tetanus toxoid. We must know what is BCG, Bacillus calmette-guerin vaccine. OPV is oral polio vaccine. DPT is diphtheria, pertussis and tetanus vaccine. Now, let us move on to the introduction to the common diseases in the human beings, like the infectious diseases or communicable diseases and the non-infectious diseases. What is health? The World Health Organization, WHO, defines health as a state of complete physical, mental and social well-being, and not merely the absence of diseases. We can also say health is wealth. In the image on the right side, you can see the logo of the World Health Organization. When people are healthy, they are more efficient at work. Health increases the longevity of people and reduces infant and adult mortality. Personal hygiene, regular exercise and balanced diet are very important to maintain good health. Common diseases in human beings. What is disease? Disease can be defined as a disorder or malfunction of the mind or body. It involves morphological, physiological and psychological disturbances which may be due to environmental factors or pathogens or genetic anomalies or lifestyle changes. Diseases can be broadly classified into infectious or communicable diseases and non-infectious or non-communicable diseases. Infectious diseases are diseases which are transmitted from one person to another are called infectious diseases or communicable diseases. Such diseases are caused by organisms and are called pathogens and are transmitted through air, water, food, physical contact and vectors. The disease causing pathogen may be a bacteria, a virus, a fungi or protozoan parasites or helminthic parasites, etc. Infectious diseases are common and everyone suffers from such diseases at some time or other. Most of the bacterial diseases are curable, but all viral diseases are not. Some infectious diseases like AIDS may be fatal. Now the classification of the common human diseases which are of infectious type. Bacterial diseases like dysentery, plague, diphtheria, cholera, typhoid, pneumonia. Viral diseases, common cold, mumps, measles, viral hepatitis, dengue fever, chikungunya, chickenpox, poliomyelitis. Fungal diseases, candidiasis, athlete's foot. Protozoan diseases, malaria, amoebiasis, African sleeping sickness, Kala-Azar. Helminthic diseases, some examples, ascariasis and filariasis. Now, non-infectious diseases. These diseases are not transmitted from one person to another. Among non-infectious diseases, cancer is one of the most major causes of death. In origin, they may be genetic diseases, example cystic fibrosis, nutritional diseases like vitamin deficiency diseases, metabolic diseases like diabetes mellitus, degenerative diseases like arthritis, heart attack, stroke, psychiatric diseases like depression. What are the risk factors of non-communicable diseases? Example, genetic factors like the family diseases history, genetic inheritance, epigenetic changes, environmental exposure based, example, radiation, toxic materials which cause mutation, environmental factors like air pollution, weather changes, sunlight like ultraviolet radiation, socio-demographic factors like age, gender, race, ethnicity, education and income, factors of self-management, tobacco use, alcohol use, physical activity, person's weight, obesity, food choice and dental health care, factors of medical conditions, medications, blood pressure, lipids level, glucose level, different viruses, obesity and stress. So today in Human Health and Diseases Part 1, we discussed about the maintenance of personal and public hygiene and introduction to the common diseases in human beings. So thank you. Kindly subscribe, like, share and comment to channel Read MedPrep Academy. Register for UG and PG NEET MCQs in our website www.readmedprepacademy.com. Our Facebook ID is readmedprep academy. Our email is readmedprepacademy@gmail.com. Our Instagram is readmedprep academy. Kindly post your questions in the comment box. We will reply with appropriate answers regarding the lecture. Join Read Med Prep Academy. WhatsApp the number given below. Thank you very much.